Everyone joining us tonight during this holiday season. We are here for another episode of Climax After Dark. Thank you for joining us. I'm so excited today to have some of my favorite people joining us for our discussion this evening. We have Meghan, Karol, and Tiffany Rodriguez, both from Movement is Medicine. Hi, ladies. How are y'all doing?
Good. Glad to be here.
Yeah, likewise. Very excited.
So my voice is a little raspy, and we might be playing musical chairs a little bit this evening, as there's three of us on the screen. So for those geriatric millennials like me, when we get a little motion sick, even with the slightest bit of movement, please excuse that. But I hope we're able to have a really good discussion. I'm excited about it because you all do some interesting work at Movement as Medicine. Um, Meghan, you've been there the longest, and can you just tell us a little bit about the practice, what the practice does, and then tell us about what you do in the practice?
Sure. So, Movement is Medicine, we're located in Norfolk, Virginia. And it primarily was, started as physical therapy. Mark and Amanda started the clinic just wanting to push better quality care for physical therapy. And they really loved treating active adults, athletes. And then about a year and a half ish ago, I joined the practice, bringing in pelvic health to that. And then Tiffany has joined us to add in massage therapy. So we really kind of offer a variety of different things, but really, you know, mostly kind of focusing on like athlete, active adult, but that active adult can look so many different ways. Even just running after a toddler is a pretty active lifestyle for some people.
And Tiffany, you're there also, like Meghan said, with massage therapy. How long have you been with the practice?
I joined them about 8 months ago. I had moved back to Norfolk from Charlottesville and had a career change and met Mark and Amanda out in the community and told them I was interested in what they were doing. And the rest is history. And I've been here since then doing massage.
And so we at Climax have been um, receiving refers and referring to you to Movement as Medicine for I think I want to say 3 years now. I mean, it's been a while actually since I've been in practice when I started doing gynecology, and just like you said, Meghan, being an active adult, that description of active um, is wide open.
Mm-hmm.
And in our practice now, what we focus on is sexual medicine, and being active in that way. Pelvic health is really important, and the healing healing um, um, therapies of massage therapy um, also really important. And I love how there's this synergy in your practice, right? How, and I see it on a day-to-day basis from like the patients that come there, and also understanding what you all do. But for those that are joining us, how does pelvic health, pelvic floor therapy, and massage therapy, how is that synergy? How does that synergy work?
So I think the classic answer is always going to be an it depends. Kind of almost every question that we go from today is going to be like, well, it depends. But
Mhm.
in broad terms, as we're looking at an individual, certainly from my lens with that pelvic health lens, um, there's so many things that throughout our day to day, I always kind of make the joke like when we're hunters gatherers and we're out in the woods and we're a bear jumps out at us, and then all of a sudden our body revs up, but then once we're back into the safety of our cave, we should realize that we're safe and calm back down. But these days, our bears just don't go away from us. And there's so many chronic conditions, or even something that starts as like an acute injury, but then just sort of never fully goes away because our bodies are just always so revved up. So in pelvic health, a term we use a lot is like down training, and just sort of calming the system down and calming your whole body down and nervous system down. And I always kind of say, like, there's only so much time and there's a lot of things that I'm trying to accomplish. And so if they can also get that complementary, care with massage therapy, that really helps, whether it's direct, indirect, settle the system. So I'll let Tiffany talk about how massage therapy really helps you shift into that more calm state.
Yeah, so it really is a beautiful setup having physical therapy and massage therapy in the same space, because we can all work together on a specific care plan. I think oftentimes the communication isn't there in healthcare. So that first part, we have that. It's in-house. And I'm able to take a patient into the room with low light. The table is warmed, have a conversation, get them on the table, and spend 60 or 90 minutes working on areas that maybe Meghan has previously worked, and bring that parasympathetic nervous system to the forefront and try to tamp down the sympathetic nervous system. So I do some of the stuff that she does, but I have more time to spend to help people relax.
More time, more technique. I always kind of say, like, there's a good overlap between us. And yes, massage therapy, soft tissue mobilization, anything you call it, isn't integrated with what I do, but it's very sort of targeted and specific to what we're accomplishing for that treatment session. Whereas again, like Tiffany said, she could spend a full hour and a half just on that, soft tissue work, that calming the system, whole body, where I might have to kind of stay a little bit more focused depending on what our goal to accomplish for that treatment session is.
So in the world of sexual health, the world of intimate care, right? And libido, orgasm, parasympathetics and sympathetics are necessary, but they have to be in balance with one another.
Yep.
For desire and then also just the physical response of female vagina being able to be lubricated, a male being able to have an erection, and then also being able to enjoy the orgasm. So all that makes sense. If you're a patient that has recently given birth, you're a woman and your anatomy has changed and your sense of that balance has changed, what is a treatment plan that can address that?
Mm-hmm. So certainly always starting with that assessment, that discussion, what her symptoms are will really kind of guide what those treatments will be. But so commonly postpartum, you're trying to reconnect with your body, those muscles, whether, it's certainly abdominal muscles, because pregnancy alone has put a lot of stress and strain on the body. Those pelvic floor muscles have been a lot of stress and strain just through pregnancy. And then regardless of birth, process, whether it was cesarean or vaginal, all those muscles now have to kind of retract, respond, and get to a new position again. So with that, it can be wrapped in so many different things. Sometimes, if there was any kind of injury or tearing involved, getting scar tissue to mobilize a little bit better, because that tends to be very stiff, sometimes painful to the touch. So getting that to be responsive to penetrative sex again, if there is a perineal tear, helping guide through even just like different position options for someone if they're not as strong in certain areas, or they're having a little bit of weakness through their hips. Like I kind of talk through hey, like use a wedge support or try these different positions, might be easier, might help your body relax, or might actually help your body engage if that's what you're needing. And then building back strength if that's what's needed through those pelvic floor muscles for that, climax response, that sexual appreciation response. Or conversely, if all those muscles are still really spasmed and tight after such a big event, sometimes getting them to calm and relax and lengthen a little bit, because we need them to both lengthen and contract appropriately. So if they're living in this tight, tense state, sometimes women experience pain with intercourse that they've never had before, just because all those muscles are so guarded and protected. So getting them to calm down, to be able to, accept penetration, appreciate penetration, enjoy penetration, if that is part of their intimacy journey for themselves. So finding, again, down training, desensitizing those muscles, getting them to calm down a little bit. So again, it depends, but there's a lot of different things that pop up postpartum that women weren't expecting. Even if it's just not necessarily during intercourse itself, but just all throughout the day, they don't feel like themselves anymore. They're not connected with their body. So then that's hard to then feel desirable if you don't even love your body anymore. So sometimes helping through that process, and helping them reconnect with their body can be very powerful.
Do you think, Tiffany, that with massage therapy, that connection can be reestablished? Because, I think about this. We, just like Meghan is saying, we don't anticipate. And then sometimes, honestly, after going through it, we forget all those changes that occur and how they impact us. One thing I thought about, Meghan, when you were talking about position, is just the fact that the uterus becomes a little lower after pregnancy, or oftentimes does, and your cervix is sitting a little lower. And so with penetrative sex, it's easier for that to get hit, not necessarily allowing you to feel the most pleasure. So yeah, position change also would help to uh, um, impact that, or change that so you're not uncomfortable. But there is also the thought process that for a lot of people who birth um, babies, their bodies after giving birth, because there is that hormonal connection with the baby, your body now kind of belongs to the baby still. So you may not feel comfortable being touched, and let's say the baby is weaned, or you never started breastfeeding, you still have, at least, and let me speak for myself, because others may not people may not want to be um, honest with this, but um, you guard your body, and you don't feel like you want to give it back to your partner, right? Either it belongs to your baby, or now I'm just getting my body back to myself after all these months of pregnancy. Let me hold on to it. So touch does not necessarily feel comfortable. Do you think that with massage therapy, or making that part of a treatment plan or part of your life after birthing, that can help guide you back to where you're more comfortable with just touch?
Absolutely. You made a wonderful point. It was one that I was going to touch on, which is introducing that non-sexualized, intimate touch. What I do is very intimate. I am asking someone to be in one of their most vulnerable states, undressed under a sheet and blanket, and being touched. And it's little things like behind your ears and the webbing of your finger, behind your knees, things that we don't really think about. But I am introducing that safe touch back and showing them that it's okay to take time for themselves. And establishing that mind-body connection, that it is okay to receive pleasure, again, in a non-sexualized way, and in hopes that opens them up to maybe wanting to be intimate again, if that is part of their journey, and having their body back, their pleasure that has nothing to do with keeping another being alive or providing pleasure in any way for anybody else. That is their time. So that, yeah, wonderful point. I think massage should be a part of everyone's postpartum journey. Yeah.
How important do you think non-sexualized intimacy is to sexualized intimacy, right? Or non-sexualized touch is important to sexualized touch? Because I like that point that you made. The touch is non-sexualized, but it's very intimate. Right?
I think it is the basis for everything, for all relationships in our life. And I think that's the trauma-informed approach that we've started to take in massage therapy, I really love, because it really is teaching people how to be intimate with others, and set boundaries, and understand that they can stop at any time, or they can say, hey, I want more pressure, or it's too hot. I think it is the most important basis for all relationships to begin.
That, I've not thought about it that way, but that's true, because we oftentimes talk about the importance of setting boundaries, but also speaking your truth in your sexual relationship with your partner of, I don't like when you do that, or you need to brush your teeth before you come to bed if you want to have sex with me. because once you come here, it turns me off. And setting up the expectations. So, how do you feel like when I get massages? I'm always if the pressure is not deep enough, I feel kind of rude to ask for it to be more deep. Is that okay to do?
It is 100% okay. I recently was introduced to a term, unreasonable hospitality, and that is what I try to embody, which is this is your time. If you are too hot, you want more pressure, you want less pressure, you want me to throw the blanket off because you're not comfortable anymore. You want different music. I even ask people, do you have a playlist that you feel comfortable listening to when you're trying to relax? Would you like water? Do you want it cold? Do you want it room temperature? I give people all of these options so that I can empower them to be able to speak up. It is not rude. Please, the next time you get a massage, please tell them you want more pressure.
Yeah. Because you know what I feel? I feel like, well, if they were able to give me more pressure, they do it. And then maybe it actually is stressing them out if they give more pressure. So just deal with what you got. It's actually not bad.
Fair. I am guilty of it too. Even though I am saying all this stuff, I'll still lay there and be like, gosh, I wish they would have spent a little more time right here. But yeah.
What about for the male patient? Because, women, I think, are a bit more comfortable with physical touch, whether it's from friends or family or an intimate sexual partner. Men oftentimes, and this may be a characterization, but I think many would agree that men oftentimes aren't necessarily as comfortable with physical touch. Um, is there a benefit to the masculine person receiving pelvic floor physical therapy and then also massage therapy?
Yeah, absolutely. So, I actually do sometimes get this question of like, hey, is pelvic physical therapy only for women? It's like, no, it's actually for men, women, and children. It's for anyone with a pelvis, and we all have pelvises. But certainly, a lot of pelvic health issues are very common in women, especially if you have, been pregnant, given birth. But we're finding more and more pelvic health problems in men too. And it's not just, as men age and have prostate issues and have post-surgical, need for care, even young, very active men have a lot of low back, hip issues. And some of that could be whether it's stemming from pelvic floor or conversely impacting pelvic floor. And sort of the joke is, men don't really know how to use their hips. They don't really know how to shimmy and sway. They're like very locked in there, so a lot of times, again, speaking very stereotypically, finding movement, finding looseness, finding, a men's ability to relax those muscles and stretch those muscles and move their low back and hips in ways that alleviate a lot of that pressure, really can alleviate those pelvic symptoms. So, whether it's bladder issues, penile issues, rectal issues, or again, sometimes it's low back and hip pain that they just don't identify as maybe being related to, how the pelvis is impacting that.
Can you speak to for erectile dysfunction issues? How can the source of a erectile dysfunction be the pelvic floor? Like, what is that pathophysiology?
Sure. And I will say, men's health isn't my like prime specialty, but for, all that I appreciate and know, through pelvic health, men's health, our musculature through the base of the pelvis, all of our arteries, nerves, lymphatic system, everything runs through all those muscles. So sometimes it can be an issue of poor blood supply, in that area. Certainly if those muscles aren't tightening, relaxing, contracting well, those muscles are involved in an erection, in ejaculation, and even nerve, supply if they're having what's called like pudendal neuralgia. So a nerve that kind of comes through the back of the pelvis, hooks around a couple of different things, if they're having any type of numbness, tingling, or just decreased sensation. They might not even realize that it's pain or numbness, tingling, but if that's decreasing their sensory input because that nerve is not running well because it's really compressed, that could potentially be impacting that ability to accomplish and achieve and sustain an erection.
Mm-hmm. You know, one thing I think that we don't often hear enough is that when we look at both a man and a woman, a female and a male gender in the embryologic being, we all are the same. Like our anatomy is coming from the same progenitor cells. And so if a woman can have decreased sensation, a man can have decreased sensation, and they all be caused uh, by the same source. Now, the physiology does change as we get old, you know, as we grow because of hormones, but um, our anatomy is very similar. The clitoris and the penis are essentially the same organ.
Yeah.
We just have different things.
Yeah, I was like watching a program once, and the person was like, same parts, just organized different. It's all the same building blocks, same pieces, just in a slightly different arrangement.
Can you speak to like athletes, right? Is there an athlete type that would have more pelvic floor issues? You know, you're a younger guy and you're in sports, and as you get older, you start to see the outcomes of your heroic days, right? When you were young. Um, is there an athlete type that would have more pelvic floor issues than another?
I actually don't know specifically,
Mhm.
but where my brain is kind of immediately going, like, at first, I'm thinking like immediately, like any heavier lifting, heavier impact. Certainly pelvic floor dysfunction is high, prevalence in military communities. And so
Mhm.
certainly,
Mhm.
a lot of athletic population, similar to that would be similar. But even soccer,
Mhm.
running, I actually couldn't think of a sport of where they wouldn't maybe necessarily issues. So yeah, now I'm gonna have to rack my brain of like who is spared. Maybe swimmers. I don't
Yeah,
know.
you know, I because one question, like when we look at some markets, right, um, and growth in those markets, the young people who are concerned about preventative care, they
Mhm.
are growing markets more and more. And so I think in this instance, right, where we're talking about decreased sensation, clitoral sensation, ED. You know, in my practice, there's a lot of things that we do for those patient types, acoustic shock wave, PRP therapy. But if you could do something preventative, right, to really help your body while you're younger to prevent some of these outcomes, that would be a good idea.
Yep, yep. I would say, in terms of like preventative care, I would really encourage people to find a mobility, whether that's yoga, whether that's stretching, some type of incorporated with like a deep breathing, getting your low back, hips, joints moving through good range of motion. And a lot of times I'm kind of changing my language right now where it's like I'm not looking for stretch length of muscle. I'm looking for ease of movement through a full range of
Mm-hmm.
motion. So I don't need you to be super flexy. I just need you to be able to, get down into a deep squat easily, get up and down from the floor, be able to move your hip in every, direction that it needs to. So, more and more and more in pelvic health, we're really kind of appreciating how much tightness tension is causing too much issues and problems. So I would say for especially a young athlete who most likely is very strong, very fit, a lot of times the missing piece that I see is that mobilization and that, mobility routine. So again, whether it's movement based, more static stretching, I always incorporate diaphragmatic breathing because you've got your diaphragm that sits right underneath your ribs,
Mm-hmm.
pelvic floor on the bottom. And as you do that deep breathing, they kind of mimic each other. And that's a great way to kind of breathe down into the pelvis, get some length through those muscles. And I always tell people, I'm like, we're talking millimeters. Like this isn't like huge movements, but you need that pelvic floor to, retract, respond, stretch, move well instead of sitting like a cement floor.
Yeah, yeah. Tight hammock.
Tight, tight,
Tiffany, what about from the massage aspect? What are some things that individuals can do as preventative in their daily lives?
So, I mean, I want to touch on the perspective with male patients.
Mm-hmm. Mm-hmm.
Um, is getting massage, receiving that type of touch. I think that is the thing that I see we lack so much. Probably 10% of who I see are men, and most of the time they don't know how to show up, what they should wear, what they shouldn't wear, how they should behave, what's okay, what's not okay. So I think there's a lot of like lack of education. And unfortunately, because massage therapy has often been portrayed in movies and such, so closely linked to sex work, there is this like, I don't know what's allowed. And a lot of men just have not been cared for in that way. Again, non-sexualized touch, where it's just, this is just time for you. And so educating them and just getting them in and creating a space that they feel safe to be able to ask questions. And as far as preventative, I mean, I really love what Meghan said. I incorporate a lot of movement in my massage. Unless you send your mama into me, I will let her sleep on the table, but the rest of y'all are going to be awake for this. We're going to move in. So I do a lot of myofascial cupping and things like that. So I am big on introducing movement so that people can recognize where their limitations are, and so they know what to work on. And I can start asking some questions like, do you work with a personal trainer? Are you having pain there? Oh, you are? Have you thought about physical therapy? So it really just opens up the conversation depending on what the client comes in with.
Do you think for men, right? Because I agree with you, the fact that massage is oftentimes sexualized in movies as a reason why men may be uncomfortable. But do you also think maybe they are uncomfortable because it's viewed less, they're viewing it less as a therapy and more as a pampering?
Yes, very much so. That's a thing that women do. They go to the spa, they get massaged. Men don't do that. They don't get that care in that way. And so absolutely, they feel like it's not frivolous, but it's just they could spend their money and their time in other ways. Yeah.
Self-care is not selfish or gender specific.
Amen.
So in our practice for women who are starting dilator therapy, I oftentimes refer them to you all. actually get the teaching, because it takes a while. There needs to be a lot of discussion. And actually, to talk about it, dilator therapy, I'm talking about vaginal dilator therapy, right? Men can also use those dilators too, for other areas, right? So because dilators dilate orifices. So anywho, but for vaginal dilator therapy, one of the things I tell my patients often is this is a therapy, but it can be part of intimacy too. So so you can use it in intimacy, starting off as a therapy, your partner helping you receive the therapy, but you all still use it as part of foreplay. And a lot of the reasons I have that conversation is because one is to bring the partner into the therapy, right? Because oftentimes the woman is suffering in silence or suffering alone or thinks she's alone. So this helps to bring the partner into her therapy, but also helps to normalize her therapy, because it becomes part of the foreplay. And, most people do foreplay before they have move on to have other forms of sex, penetration, and so on and so forth. But it's a dicey conversation, right? For me, it's a little easier because I talk about sex. That's what you're here to figure out, how to have better sex, right? And your roles, I would feel just like Tiffany was saying, we're not trying to sexualize the touch that you give, but you want to give your patients some pointers on what they can do at home. What are some of those pointers for those that are listening?
Meghan?
Oh no, I think that was a
okay.
Well, both of you.
So some things that I incorporate, again, it's that fine line where I want to be professional, but understanding that there may be some other things going on, is if I do something and I see that they really enjoyed it, I will say, this is something you could do with your partner. This is this. There's simple things like I do this like eyebrow squeeze, and then I do or like in between the eyes and then around the eyebrows, and people are like, oh, "This is amazing." And like, you could do that. Like, that is a good way to introduce that type of touch to your partner, get everyone relaxed. Foot massage is another like very accessible one. And even back massage, pointing out, I'm doing this because did you know that your upper traps go all the way up into your head? So if you were to rub your partner's head, that gets them relaxed, that brings their shoulders down. So I talk about it in that way. And then on some occasions, people will have an emotional release that may look like crying. Sometimes they may tell me things while they're on the table. And so just holding that safe space for them and kind of being an ambassador for this is what this looks like is about as far as I get into it in terms of if there were any like sexual issues outside of the room or in the relationship or anything like that. I don't get too deep into it based on my scope of practice.
But there are techniques to take home,
Absolutely.
Yeah.
The diaphragmatic breathing that Meghan brought up is also an excellent one. While I can't really say like that could really enhance an orgasm if you were able to breathe well, but teaching them what it's like to fill up their belly and their chest and expand out in the ribs, and just that connection in their brain. And then I kind of leave them with that and send them on their way.
But diaphragmatic breathing can really enhance your orgasm. I'll say it. It can. I mean, these are like tips, right? And they're in our everyday experiences where we may not realize how they can impact other things. Diaphragmatic breathing can help your mental health. Diaphragmatic breathing for those with anxiety and elevated blood pressure can help them in their calming. So I think I oftentimes say that it's a shame that we have sexualized so many things in this country where we can't have open conversations that really can help people move the needle in these parts of their lives where they really need to. Because even like you're talking about the touch for the eye, right? And you go home and you do this with your partner, and then you all have sex. The amount of coupling hormone that you produce in oxytocin by just letting them do this to you, that helped you with your orgasm. So I feel I don't know. I wish there was a way that we could have conversations about sex without them always being taboo. Then this, I guess, is a forum for that.
Yeah.
I guess I'll have to go back to school, and there might be a license out there for that.
Yeah.
Meghan, were you going to say something?
Yeah, kind of, related, because a lot of times, obviously like it is within my scope to be talking about sex and intimacy and all of those different things. But a lot of times, I have my little like anatomy pelvic model with the muscles and all that. And I always tell people, I'm like, when I'm asking these questions, when I'm, digging in for more details, like this is what's in my brain. Like I am thinking about how this whole system is working together. Like I'm not thinking about, you and your partner, like that's not what it is. And obviously you can't totally divvy out everything. Like sometimes I do have to kind of go into the like, hey, like maybe, especially if they're having pain with penetration, I usually kind of use the example of like, if we're sitting together and I like lunge at your face, you're going to sort of react. But if you touch your face, or if you take my hand and touch your face, then you know what's coming. So even talking through like guiding your partner in, or you kind of initiating their touch on you, so that way you're sort of in charge of that, or your body knows what's coming. And then, like you said, like with, integrating their partner in any type of their, whether it's dilator therapy or anything, again, a little bit of like, where are they in their therapeutic path? Because especially with, dilator therapy, the biggest piece that I'm always teaching is it's how is your body staying calm and calming down in reaction to a touch that is typically very pain provoking and very causes your body to react. So they really have to work on calming their body down, feeling in a safe space. So certainly the goal is, or I shouldn't say always, but a lot of times these, women are coming to me with the goal to have partner penetrative intercourse. So at some point we need to incorporate their partner into that. So again, it's kind of like, where are they in their therapy and their, improving? It's like, hey, are you ready for your partner to be involved with this? Like, can this be just like if you're going, out for an athletic event, you do your warm up first. Or dilator therapy, stretches, diaphragmatic breathing, all of that is your warm up, to, what we don't always think about is like this athletic event, but man, is it a physical event for us to be involved in. So lots of different avenues and tips and approaches to that.
We just got a comment from Shelby saying, appreciate this conversation. Thanks for sharing your expertise, ladies. Shelby, thank you for the shout out. This is something that we should talk about a lot. And we should also be mindful in making sure that we're giving correct tips. One thing I will always say is that if somebody gives you a device and they don't give you instructions, right? They've not done you service. No one should receive dilators without instructions on how to use it. And I've had tons of patients who have come to me and they've had conditions like vaginismus or vulvodynia, and they were prescribed dilators or told go buy dilators, and then was told to use them without the expertise, without the instruction. So it's important. It's important that when you're getting care from a provider, that they're giving you complete care. They're not just sending you out into the wild to figure it out, because that's not appropriate.
Yeah. And I feel like, kind of like what we were saying about with stretching before, like very common with dilators, and it would be so easy to misconstrue what the purpose of that is. So someone might receive a dilator and they're like, I'm going to stretch that tissue and sort of grit and bear it and force it to stretch to a greater size, which might be a piece of it. But again, it's that body reactivity to it, and how do you body response to that and gradually build up to it. If it becomes a painful event, you're just keeping that vicious pain cycle, versus how do you shift your body to being like, it's pressure.
Yeah.
Stretch. It's a non-threatening stimuli. And then your body's going to better tolerate that circumferential stretch, building up, to greater sizes. So again, if someone just kind of, receives their set, they're like, all right, let's get to it and force that stretch and force that stretch. And even as we were talking before about kind of male, female, all these other different conditions, again, you mentioned dilators are not just for females, but it's also not just for vaginal penetrative intercourse. You can use rectal dilators if you're having issues with constipation.
Yeah.
Both men or female, just those muscles need to stretch, whether it's coming in or coming out.
Yeah. We talk about on the science side, neuromodulation, neuroplasticity, and the body learning, relearning, and nerve endings being repurposed for what stimuli they take back to the brain. And so having this biofeedback therapy, or making it being part of a kind of like biofeedback therapy, you have to have education on that.
Yep.
In these last couple moments, Tiffany, you're going to say something?
I was just going to say that it's a great point to massage. You don't come in and get deep tissue right away, right?
Yeah.
You have to work up to it so that the body is used to that pressure. And over time, I can get a little deeper. So very similar. The goal is to be able to take that deeper pressure, but we got to work up to it and educate that, this might be uncomfortable. That is normal. Discomfort is okay. Pain is not. And we can work towards it. So similar goals.
Yeah. Actually, in these last couple minutes, I do have a question for you on that deep tissue massage. So is it a bad thing to always get deep tissue? Should you kind of spice it up and mix it up?
It's not bad. I think it's important to try many different forms of it. I think there is a place for energy work. There's a place for deep tissue, and then there's a place for maybe light to medium touch. And there's so many different practitioners, and massage therapy is so varied. I think it's important to kind of go out, even if you're not comfortable with it, and go get some Reiki or go get foot reflexology. But yeah, if you love deep tissue, go. You can do it all the time.
I do love it, but you're right. There is something to variety. There is something to spicing it up. And there's something to allowing yourself to experience others, because you might be able to release when you weren't able to, when you always got your routine and got your regular. So can y'all tell us again where you're located and how we can contact you individually? Meghan, I'll have you go first.
Yeah. So again, Movement is Medicine. Our main clinic location is in Norfolk, Virginia on Colley Avenue. And I also, one day a week, currently see clients in the Greenbrier area in Chesapeake out of the Juniper House, still under the Movement is Medicine clinic name. Yeah. So for me individually, you can find me if you're on Instagram at mkarol.dpt. I spell Karol just that little different. Or certainly my email address, I think, is scanning across there. Again, mkarol dpt at Gmail. And then our clinic website is movementismedicinept.com.
And you can find me in the same place. And then on Instagram, it is MIM-massage. Otherwise, yep, same website, same email, and phone number. And I'm at Colley Avenue 6 days a week. So,
and you're there right now. You all have a beautiful space.
Thank you.
Your space has beautiful energy, and the two of you together have beautiful energy, and that the synergy amongst you all as a group in your practice is just infectious. I do want to say thank you for taking care of my patients. Thank you for taking care of me also, and providing referrals. I enjoy working with you all, and I enjoy partnering, and I think I'm lucky to have you all in my community of colleagues. So thank you so much. Thank you for being here. Thank you for the lively discussion. And if we just every time, talk about what those may seem to see as taboo, but really we need to have these conversations, because people need to hear this expertise and hear this information so that they can have healthier lives. I thank y'all for being here.
Yes, yeah. Thank you for having us. Thank you for trusting us with your patients. And we are also so fortunate and lucky to know you well, work with you, collaborate with you. We love our partnership.
Oh, thank you. Thank you. Everyone, thank you for joining us. Enjoy your evening. This is Climax After Dark.